You know what I took now? It's a vitamin D tablet. Why I should take vitamin D? Because it is very important for our bone. It increases the absorption of calcium, magnesium and phosphate in our body. Whenever there is a deficiency in vitamin D, there will be a weakening of bone because there will not be a complete absorption of calcium and thereby it will weaken the bone. So where we can get this vitamin D? It is not necessary that every time you have to take vitamin D supplements. The sunlight is also an option where the skin gets exposed and it forms vitamin D in our own body, which is a natural process. In case if it is not happening, the amount of vitamin D we require, then probably we can take vitamin D supplements. If there is a deficiency of vitamin D, what will happen? In kids, it can form rickets. Rickets means there will be a weakening of bone, and probably you can visit your pediatrician. They will give you vitamin D supplements or injections, and thereby they will treat rickets and it is completely curable. In elderly people, it can cause osteomalacia. This osteomalacia is nothing but the weakening of bone and thereby it will cause fractures. This is more common around the hip joints and also in the spine. So once we treat this vitamin D deficiency itself, this will normally cure that fracture and heal completely. We have to make sure that whenever there is a pain in and around the hip joint, you better visit your orthopedic doctor and get treated than leading into a complete fracture. So what is the normal thing which is required for vitamin D is 30 nanogram per ml. So this is what we are looking at, and we have to keep this target. And best time for sun exposure is morning 10 a.m. to 3 p.m. where UVB radiations are very high in that sunlight, and that is very important to form vitamin D in our body. So it doesn't mean that many patients we ask, sir, if we go and sit under the sunlight will become dark. So in case if you're scared for that, then probably you can take vitamin D supplements. The vitamin D supplements usually are given once in a week depending upon your blood level of vitamin D, and thereby after that you can probably maintain your vitamin D by taking once in a month. You should not overdose yourself with vitamin D because it can cause toxicity. During this COVID time, we have seen that how vitamin D has helped in increasing our immunity and fight against this COVID-19. Wherever we have found that vitamin D is low in particular patient, they all had a difficulty fighting this COVID-19, and whoever had a good vitamin D supplements, because it has increased the immunity, thereby those people can fight very nicely against COVID-19. So this is very useful. Please maintain your vitamin D levels, thereby there will be increased calcium absorption and it will maintain your vitamin D levels and calcium levels in the body. Thank you.